Now we're going to talk about the chemotherapy for ovarian cancer. The good news is that chemotherapy is very effective for this disease. In fact, most of the drugs that we use now are much better than the older types of drugs. They have fewer side effects and they work better. And what we're going to do is administer them to you in a way that gives you the best possible chance of getting rid of the disease. Chemotherapy seems like it's complicated, but it's very, very straightforward in the sense that it's usually given on a very particular schedule, on a regular schedule, and it's something you can prepare for each time. There are ways of preventing side effects by taking other medicines to minimize any side effects that you might get during chemotherapy. So we'll be talking about how to arrange your chemotherapy, what the side effects are, how to prevent side effects, the schedule that you'll be on, and what to expect during your treatment. We'll also be talking about how we keep an eye on you during your treatment, how we monitor the disease, what blood tests we do, what x-rays we might do, other types of scans before, during, and at the end of your treatment.
Surgery does not completely remove all traces of the cancer, and there will be some stray cancer cells probably left behind, cells that one cannot see with the naked eye or feel by hand. And in that situation, the role of chemotherapy is to destroy these cancer cells that are too small for us to cut out or remove, and remove any traces of the cancer from the bloodstream or in the lymph nodes. That's the main goal of the chemotherapy in that setting. For cases where the cancer is in its early stages or in its development stages, chemotherapy works not only to kill off any remaining cancer cells, but also in some ways to prevent any reoccurrence of the cancer later on. The trend with chemotherapy for ovarian cancer is to give it either on a weekly basis or 2 weeks in a row with a 1-week break before restarting. Depending on the approach for chemotherapy, whether it's inside the abdomen and in the vein or just in the vein, one would go for one of the two schedules. Typically when chemotherapy is given in the vein, especially when it's the first time around, we tend to give chemotherapy every week. That's been the trend in our specialty. If we're giving it inside the abdomen and in the vein, we usually do 2 weeks on and then a week off before restarting.
So typically, once you're on the course of starting your chemotherapy, your visits will include a visit in our office to have your blood test checked, to see either a physician or one of us nurse practitioners for an exam and to see how you're doing, and then you'll proceed to the infusion treatment area, which is in the main cancer center across the street from the Women's Cancer Center on the 2nd floor. When you check in the infusion treatment area, they will also review your lab tests. You'll meet your nurse, and they will start your IV for you. Through your IV, you'll receive 3 different things. Pre-medications that are helping to prevent nausea and prevent allergies to the chemotherapy. Second, you'll receive some fluids, IV fluids or hydration to help hydrate your body and protect your kidneys and help flush the chemotherapy. And third, the actual 2 medicines of chemotherapy themselves, which are usually carboplatin and Taxol. So the infusion treatment area is a large area where all of our patients receive their treatment. Patients are usually set up in a recliner or in a private room. Typically for our treatments, a recliner is sufficient, and you may be in a room with several other women who are receiving chemotherapy for various types of diseases. The room has large windows. You can bring something to eat, you can bring something to read, you can bring your iPad and watch a movie. We like to make it as comfortable as possible for you. You can bring a friend with you as well to keep you company, but typically you plan to be there for about 4 to 5 hours for your treatment. It takes that amount of time to receive all the pre-medications, the fluids, and the actual chemotherapy itself. The chemotherapy that we use for ovarian cancer includes 2 medicines called Taxol and carboplatin.
Women always ask what to expect when they're facing chemotherapy. And in most cases, in this situation, women can expect to lose most or all of their hair. Women always ask about nausea and vomiting, and I think one of the biggest advances in cancer care in the last several years has been in ways that we treat side effects or even prevent side effects that are caused by chemotherapy or any cancer treatment. And one of those specifically is medications that we use to prevent nausea. We use these particular drugs in women in all age groups, and women tolerate it very well.
The other big symptom patients complain of while they're getting chemotherapy is fatigue. Fatigue is almost universal in this setting.
We also see our ladies each time they get chemotherapy, and at those visits we go over all of the major side effects. What are they feeling? What are they experiencing? And we can tinker things in the dosing, in the other medications to help make their experience a little smoother.
So one of the most important reasons to call us after chemotherapy is if you develop a fever over 100.4. The reason we worry about a fever is we worry about your white blood cell count becoming too low and being susceptible to infection. Other reasons to call our office after chemotherapy would be if you were unable to eat or drink anything because of nausea or vomiting, if you were having uncontrolled diarrhea more than 3 to 4 episodes in a day, if you had any shortness of breath, or developed a rash or hives after chemotherapy, and also if you had any swelling in your legs, unequal swelling on one side versus the other.
We have different ways of assessing whether a certain treatment works for your cancer. We perform pelvic and abdominal exams during your monthly visits. We determine the tumor marker level CA-125 in your bloodstream. This is particularly informative if this level is elevated. It will tell us whether a certain treatment really is efficacious. In addition, we do imaging studies. In particular, CT scans help us to measure the size of a tumor. And if we see the tumor shrinking, we assume that the therapy is working. In these situations, we might continue the chemotherapy for more cycles and then reassess the effect by CT scan.
So we've heard a lot about chemotherapy for ovarian cancer, and while we've given you a lot of information, there's a lot more information available. Look at our website or call us. Contact us through My Health. If there's ever an emergency, go to the nearest emergency room or come to Stanford, but let us know that there's a problem. We look forward to continuing to care for you.